Meeting convened. I'm going to ask everybody to stand as we pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and justice and liberty and justice for all. Amen. And I'm going to ask our Commissioner Williams, since he does such a sincere job, if he will give us the invocation.
Thank you, Mr. Chairman. For those so inclined, please bow your heads in prayer. Lord, as we gather here tonight, we ask you to please cover this assembly with your amity, with your wisdom and friendship, and help us to understand and discuss and deliberate and decide with the best interests of Union County in mind. Amen.
Okay, I hope that everyone has had a chance and opportunity to review the minutes from last month's meeting. And if so, I'd like to have a motion. Someone would give me a motion to approve those minutes, or any corrections needed? So Brandy, got a motion by Brandy. Anybody second? Second by Mark. Okay. All in favor, say aye.
Aye.
Opposed? Okay. Approved. So I don't think there's any old business. Oh, yes, okay, I'm sorry. I forgot about that. Okay, how about the agenda? I believe it's a short agenda here today. Do we have a motion to approve the agenda? Okay, Margaret's motions, second. Anybody want a second? Okay, Brandy, a second. All in favor, say aye.
Aye.
Opposed? Okay, so the motion is approved. Now we can get into the executive director's report.
Good evening. I think this is, yes, it is, okay. So tonight I wanted to cover a couple of things. I only have one thing that is written as an agenda item, and that is an update on the FY25 budget, which if it's okay with you, we'll do last, but there are a couple of other just operational things. One is Carla sent out to you all earlier today, actually, link to the 2023 SOX report that Stephanie provided an update on at the last meeting. So I just want to make sure that you saw that come through. If you have any questions about that, follow-ups, obviously Stephanie is available, or any of us are, to speak to that. The second is news on our organizational leadership. We are thin tonight with the directors at the table, but that is not due to this update that I'm about to provide. It's just due to other conflicts that occurred from a schedule perspective. But I do want to share with everyone that Dennis Joyner is going to be retiring at the end of December 2024. And that is after 38 excellent years of public service, the last 7 of which will have been with Union County, helping to promote and protect the health of our residents. And so we obviously have been blessed to have Dennis here with us as a leader and a teammate, and will continue to be blessed. And if he were here, he would want me to say that he intends to fully serve, and he said this to his management team, to fully serve through the end of December. And I have no doubt, knowing Dennis and everything about him, that he is 110% committed to making that happen. But also, we are going to go ahead and post his position, and I'm going to work with Jackie and Carla to make sure. We're going to talk with the accreditation consultant, which I'd like to ask Jackie to give a brief update about accreditation as part of this as well. But we're going to talk with the accreditation consultant to make sure that you all do not need to review the job description before posting. There are some requirements in association with that. At a minimum, I'll make sure that I send it, Earl, to you and to Amy as the chair and vice chair, just to review at that level. But if we need to review it from an accreditation perspective, we will get that direction and send it to you. If that has to happen in person, then we will not post it until after the August meeting. If that does not have to happen in person, then my plan will be for us to post that position beginning in July. And so the goal there would be to have a long enough runway to be able to have a transition, and hopefully to recruit someone to come in and serve alongside Dennis in that space, and so that we'll be well prepared. That being said, I do want to mention that Dennis has built a really strong foundation. And so while we're going to miss him and miss him terribly, I'm confident, and he is confident, that the team members who are in place, and I keep looking over at Megan, but Megan's one of those, and Tracy is one of those as well from an environmental health perspective, that are in place are strong and competent and caring, and they have the foundational infrastructure that is needed to continue to move forward with all of the public health clinics and dental clinic, our physical clinic, our environmental health services, our education components, everything that we do from a public health service perspective. We have a wonderful, skilled staff who will keep things moving forward. So that hopefully will be a smooth transition. And again, if you know people, one of the reasons that I want to make sure that we get this out early is so that we can start recruiting and having that message out. And there are a number of excellent, talented people within this organization and across the state and in other states that, Union County is an excellent place to live and an excellent place to work. And I think that's a fabulous opportunity. So if y'all are aware of anyone that you think would be a good candidate, reach out to them, talk with them, and let them know that the opportunity is upcoming. Jackie, with that being said, just for a moment, you want to give a quick update on accreditation?
Sure. As Janet mentioned, we have accreditation this fall. October the 16th is the date for the site visit. They will be here with us for the full day. It used to be 3-day site visits. They've condensed that down to 1. Carla submits things to them electronically, and they review prior to getting here on that date. They will spend the whole day. They will do a facility tour while they're here. And in addition to that, they will interview folks from the department. They will interview key community partners. We will submit those folks' names to them before they get here. And they will also be meeting with Earl and Amy as our board chair and vice chair. That will be part of the site visit as well. They this year may be a little bit different in that because of COVID, normally these are 4-year cycles for accreditation. It's 6 years of evidence. And just to put the scope out there of what Carla and all of our public health folks have been working toward, it's 41 benchmarks and 148, is that correct still? Or did they add some? 148 activities across 5 different pieces, like facilities. You all are the governance piece. There's a policy piece. There's an assurance piece. It touches every single aspect of the department. The things that happen in our community support, SOTS report, CHA, those are part of it. All the program letters, the program audits that happen every 3 years in our clinical services. Megan's part with epidemiology and CD team and things of that nature is a huge component. Jason, that presented to you for preparedness, is a huge component. We couldn't do it without Tracy and environmental health. And I'm going to call out Charlotte Kazai and the wonderful work she does in the community for children's environmental. As Janet alluded to, we have such a huge, wonderful team here that does great work. And it really is, while it's a lot to put on us to compile and report to the state, it gives us an opportunity to show off a little bit all the fantastic work that gets done here. And this year we're going to have the opportunity to showcase Dr. Broadway and what the veterinary component is, and that's very unique in the state. And I look forward to getting some wonderful feedback on the things that he's been able to contribute and the evidence-based things we've done in the rabies space and whatnot. So I think it's a great opportunity. And Carla's done a wonderful job. This is her 2nd time doing this for us. Last time we were accredited with honors. So I look forward to a similar result, and I'm thankful and proud to be part of this team and part of Union County.
And Jackie, will they be giving us like a preview, or will you guys give us a preview before they actually come down and want to meet with the board members?
Say a little more, ask that a different way.
I was saying, will you give us a preview, or will they give us a preview of what they're will be asking or looking for when they meet with us?
When they meet with you, they will probably ask things about the board piece, the governance piece, things of that nature, in terms of what all your interactions with public health, with the health director, things like that. If you're interested in reading before they get here, I can't promise you it's all going to be super interesting, but it's called you'll hear us refer to the HDSAI, which is the Health Department Self-Assessment Instrument. And that's the tool that we have to upload information into the dashboard. That's their specific requirements. So there is a whole section on governance, and then that's probably what they'll ask you about, is the things that feed into the governance piece.
And we will make sure that you are fully abreast of anything that you might have questions about prior to that.
That's a mandatory element of part of this assessment?
Yes.
I was going to say thank you, because throughout the year we're voting on things, but as far as trying to remember all that.
Oh, no,
You do not have to remember that level of detail.
Just to have an idea, about some of the things that we have voted on and passed and whatnot, just so we can be, I guess, ready.
It's actually at 12:30. They sent us back the schedule. 12:30 on the 16th is the specific time for the interview with you all. So
I'll send out a calendar invite.
Okay.
We'll send out
And
save the
this is
date.
in this location?
Yes, sir.
Jackie, who is expected to participate in that?
In the meeting,
Yes.
just the chair and the vice chair.
Oh.
Now, if one of them can't do that, then someone else can, but it's typically the chair and the vice chair. And
So you're all welcome to join, if you are so inclined.
Okay, well, thank you.
They will visit here, but they will also visit
environmental health because that's considered public health from a statutory perspective, so they will also tour Tracy's building and her piece of that.
And how long does it take for them between their assessments and the?
When they give us an answer, they will do a closing conference with us, and they'll tell us kind of high level what their impressions were and how the day went. And then it's not until
November.
It's November. We go back to Raleigh and we are officially given our results, and they'll tell us how many things we missed. They usually give you like a CQI, what you can do to improve. There's only two options. You're either accredited or you're conditionally accredited. And if you're conditionally accredited, that can impact your funding, but that does not typically happen unless you really don't, and that's not going to happen. Is it, Carla? We will do great.
Not at all.
We'll do great.
Okay, thank you.
Thank you, Jackie. I would also like to let you all know that at its June the 3rd meeting, our Board of County Commissioners did appoint 4 new members to this board. Susan Marciniak will be the other person, nominee who was appointed. Craig Kalash will be the physician. Jill James, the registered nurse, and Dr. Wendy Sellers, the social worker. And so Carla is working to schedule them for orientation, and then our goal is to have them oriented and that they will be sworn in prior to our August meeting, and so they'll be able to begin participating as a full participant at that time. Would you like to add anything else to that, Commissioner Williams? Okay. And then just for awareness and a little shout out, since that way I don't have to speak again at the end. We held a senior nutrition volunteer luncheon this past week. It actually was a volunteer luncheon. We had about, I'd say about 100 participants. We have obviously really way more volunteers than that, but anyone who had at least 20 hours volunteer service throughout the year in a number of programs was included, and those programs include Veteran Services and Christmas Bureau and our volunteer income tax program, as well as the library and other non-human services related programs. So we had a number of volunteers from who support a lot of different Union County programs and services, and the majority of them do also support senior nutrition. So we typically have thought of it in the past as a senior nutrition volunteer luncheon, but that was a special event and a really nice time. And we're always still looking for volunteers. So 1 hour a day, roughly, as many days of the week as you'd like to serve, or anyone that you know would like to serve. And then lastly, the budget. Just want to let you all know that the county manager did present his FY25 proposed budget at the board's last meeting. The public hearing was held on June the 3rd. And the manager's focus really prioritized existing staff in large part, and includes proposed adjustments that also will hopefully help us with recruitment and retention, which is something that you all hear from us every meeting. That is an opportunity that we have. The proposed budget does include $5 million for an anticipated classification and compensation adjustment. It also includes a new classification plan that has new pay bands, some new positions, that sort of thing, which annually the board does adopt a pay plan, but this was a complete overhaul to the existing pay plan, and so hopefully that will allow us to be positioned as a county to be more competitive when recruiting, especially against other local governments in the region. And just really want to thank the county manager's office and the board for considering that, because it matters. In addition to that, in terms of supporting employees, there is not a proposed increase this year to health premiums, and that is a big deal for current employees as well as for retirees who happen to qualify for that. So there were a number of target reductions that were implemented by the management team, some creative use of funding that is proposed and recommended that has to happen, and anytime there's a tight budget, and oftentimes there's a tight budget, and so but very much appreciate their efforts. I did include for you all in this packet each of the individual full proposed budgets for each of our 6 divisions. I'm not going to go into the detail of those because unless you have specific questions, but wanted just to make sure that you're aware. It has the mission, has the departmental services provided, a brief discussion of key issues, opportunities, concerns, requests that were made in FY25 or for FY25, and then a couple of graphics that describe the revenues and expenditures by year, just from an awareness perspective, as well as FTE. One of the FTE things that you'll notice that is sort of unique for human services specifically is that the staff who report through a structure aren't necessarily reflected in the specific budget where they're reflected here. So for instance, Jackie's team in the business operations department has a specific FTE, but there are a number of her FTE who report through business operations and support those internal support functions who actually show up in either the public health or social services budget, and that has to do with reimbursements and federal and state funds. So just for your awareness, the FTE, the total FTE reflected is accurate, but in terms of how this is shown, it's just reflecting FTE that are associated with the budget, not necessarily operationally. And then there also are some performance measures that are included at the end of each of the sections, and if you look at each of those in a nutshell, we're doing well. And as at a holistic level, we have a couple of big things that were requests that were approved within transportation. There are 2, or are proposed to be approved, are recommended for approval. We have 2 new FTE positions. One is a driver and one is a human services supervisor. I don't know if Teresa later will say anything more about that, but those 2 positions will actually be fully funded. We expect our Medicaid revenue associated with provision of Medicaid trips to be able to cover the cost of that, so we don't expect that to be any increased cost to the county, but it will provide increased capacity, and so that is a real blessing. We have several positions that have been funded for the last few years through public health and actually public communications through ARPA dollars. We actually had 10 originally that began during the initial part of COVID and have been funded since then, and those dollars are transitioning. Well, they're being spent, fully expended basically, and then they'll be transitioning. But so we have funding that is approved for those positions are going to be able to move forward. 7 of the 10 are needed, so those that weren't needed for sustained operations, we haven't requested those, but in trying to be good fiscal stewards, we do have a number of infrastructure positions, 7 of them, that will be recommended to move forward, and then those will actually have to be requested and integrated into the department's operating budgets in future fiscal years as well. We also have a recommendation for a new FTE eligibility specialist, and that's something that I know Karen cares greatly about, and as a senior eligibility specialist in adult Medicaid, as well as a new social worker in guardianship and adult services within DSS. And as we've talked about a number of times, impacting all of our programs, our population age 60 plus is increasing, and the adult services program specifically actually serves anybody over age 18, but that whole population increase is really driving the need for additional support in that area. So very appreciative of the manager for enabling us to begin to get out in front of that so that we're not behind the 8 ball there. And then there were a couple of things that we did request that were not funded that I just want to call out, not in any sort of a negative way, because money is limited and resources are limited, but just for awareness. 2 of those are associated with the dental clinic. So actually in FY24, we did add a new provider. So that was a blessing, and that capacity then has expanded. Since we've added that new provider, volume has increased. And that increased volume has required us to think differently, and we've done some things from process efficiency, but we requested some administrative support and a dental assistant that could help improve the efficiency of the dentist, and those were not funded for this current year, and that's okay. We still are able to provide excellent dental operations. There is, however, and it would exist prior to having any new positions anyway, but we currently have limitations on our capacity in dental, and so we're not accepting any new patients until after January the 1st of 2025. And so that appointment limitation matters from, you know, a service capacity perspective, and we will do the maximum that we can, and that is good. And then the last component is the funding request for senior nutrition food. We mentioned in the presentation that Emily provided to you back in April, a number of different components there. And there was a request of a net county expense increase of about $170,000, and that was not funded. And so Stephanie and her team are working to, and at your excellent suggestion, and thank you for that, to enable us to have a broader focus on giving and potentially accept donations and solicit donations and have stronger partnerships with the community, whether it be with individual citizens and residents that might want to give, or potentially business and industry. And we don't obviously have that fleshed out yet, but working with finance to determine what the options are there to potentially offset necessary county dollars. And we will, we currently have a waiting list now of 600 seniors. So that continues to increase. I believe it was around 480 when we spoke to you back in April. And I think that's probably due to a lot of different reasons, right? Not just population, because clearly our population isn't increasing that quickly of seniors, even though it is increasing, but inflation, you know, and the demands, many seniors, budgets, available resources are limited and constrained, and with inflation, that puts a greater squeeze on their capacity to care for themselves and have their most critical needs supported. And so we've seen more people reach out, and I think that's largely the driver. But we are taking people off the waiting list as we're able. We just don't really have funds to make that happen. And so we're going to try to look creatively. If there's other grant funding, we'll try to bring that in. And we will continue to do as much as we can to serve that group to the best of our ability. And that's really all I have in terms of the budget update, unless you guys have any questions, or if anybody around the table has anything else that
Yeah, I have a quick question. I know when Ashley was here in the past, you and I have always been concerned and interested. You know, she spoke that the state was given specifically for Medicaid applications some type of break. And then I was reading the report. It says that with Medicaid expansion, that the individuals served in applications increased 25%. I was thinking that's kind of low, and I was going to ask Karen, can you speak to that a little bit? Because this says 25% increase, and when Medicaid expansion came in, you know, that kind of opened up the floodgates. I was just surprised that it was only 25% increase.
So I think some of what happened was the state, when they did Medicaid expansion, those who were receiving FFM were automatically moved to Medicaid expansion. And so, well, FFM is the marketplace. So they were moved to Medicaid expansion cases. We have had a lot of applications over the last couple of months from the marketplace as well. And I just actually looked at the numbers today, and we're averaging between a 5 to 6% growth every month in the number of those who are being certified for Medicaid expansion. What we have seen lately is that the income of those who are applying is over the income limit. So while Medicaid expansion is great, the income limit for a single person is still very low. And we're unable to approve them, obviously, if they're over the income limit, and especially if they don't have any current medical bills that we can use towards a deductible to be able to approve them. So I think that some of it is income. People have gone back to work and they're making more than they were. So it's kind of putting them out of qualifying, but we are seeing between a 5 and 6% growth every single month. Right now, our current number is, as of May, it is 6,321 active Medicaid expansion cases.
Anybody else? Anybody else have any questions?
Thank you very much. Well, we do, yes. Tracy Colley has the next agenda item.
Good evening, everybody. I think most of you know me, but I'm Tracy Colley with Environmental Health. So this evening, I'm going to provide the annual wells and water quality update on behalf of Environmental Health. And just to begin with, just to give a little background summary, I try to start here and then move forward with specifics to Union County. Environmental Health is required to enforce rules and regulations through General Statutes 87 to 97. There are several sets of rules that we're responsible for. Those involve construction standards of wells, permitting and inspections, well water sampling, and protection of water supplies. That last one, protection of water supplies, we call them the 1700 rules. Those regulations deal with wells that serve some of our permitted or licensed facilities, so like a restaurant or a residential care facility, migrant housing, child care facilities. The requirements for those wells are a little more enhanced because of the obvious reasons that they serve the public. And then Union County has a local public health irrigation well ordinance. And that went into place in 2008. So many of you have heard me speak about this in the past, but Union County is very unique from a geologic perspective. About 2/3 of the county is underlain by the Carolina Slate Belt. That is metamorphic and sedimentary volcanic rock. It's a volcanic formation. It's characterized by fracturing, vertical and horizontal fracturing and cross-fracturing, which makes things a little more challenging in Union County from a drinking water well perspective and the construction of wells. Not to mention septic systems and soils, but this evening we're just here to talk about wells primarily. So you see Union County there, and that orange coloring there is the representation of the slate belt, the Carolina Slate Belt, and those formations. Just to give you an idea of our programs, or our services we provide through the well program, obviously permitting, that's new wells, repairs of existing wells, and the abandonment of existing wells. We want to make sure that's done correctly. An improperly abandoned well or a well that's just left to take on surface water or other contaminants can actually contaminate the groundwater and affect other wells in the area for folks that are served by wells. We conduct inspections and consultations, lots and lots of consultations, lots of calls, lots of questions, and that includes not only drinking water wells but irrigation wells. We offer a variety of water sampling and analysis. That includes bacteriological analysis, an inorganic panel, which is about 20 constituents, including arsenic, manganese, lead, pH, calcium, zinc, like a whole variety. We offer nitrate and nitrite sampling, petroleum sampling, VOCs, pesticide, herbicide, and that's for both new wells that are required to be sampled for certain constituents and also existing wells. So someone in the community that wants to properly maintain their well and get an idea of what their water contains, we offer those samples also. For all water samples that are collected and the results being reported, we prepare what's called a health risk evaluation, an HRE. So we basically conduct the analysis for the individuals of their sample results and let them know where they fall in relationship to the maximum contaminant levels that have been established by EPA or secondary maximum contaminant levels. And then indicate if there is an elevated result, what the issue is. Can it be a health problem? And then we include educational information along with those results and the health risk evaluation to assist folks. We also provide information on treatment options that are effective for whatever constituent may be elevated as a way to also assist folks. We offer a downhole camera assessment. So we have a downhole well camera that we lower into the well to look at the formation. It helps us to look at the construction of the well to determine if the casing is at the appropriate depth, if there's any damage, what's going on below surface, so we can better determine how to repair that well. If we do a liner or something like that. And then after that's done and the repair is done, we do follow-up sampling to make sure that if treatment is installed or repair is done, that issue has been remediated. We do a good bit of community outreach and education related to wells and water sampling. I included some of that information in the packet that I think Carla included. One of those I'm especially proud of, and that's the treating arsenic in well water. That information, and this flyer, as a matter of fact, is something that we developed in-house. We pulled the information together, we worked with public communications. We really orient all of our education and outreach information to be especially helpful to the citizens and well water owners in Union County. Yes, sir?
If detected, is treatment mandatory?
It is not mandatory. It is not mandatory. And I'll have a slide on that. So private drinking water wells, after the initial approval and sampling of the wells, the maintenance and ongoing repair and oversight of a private drinking water well is the responsibility of the property owner and the well owner. What you have to remember is private drinking water wells are not governed by the Safe Drinking Water Act the way public water is. It is the well owner's responsibility.
Wow. But the health risks are borne by the state.
Beg your pardon?
The health risks, if they don't choose to take the treatment option, is borne by the state.
I mean, I guess that could be said if they're, chronic health issues or something like that. But, we're also concerned about that, and some of our work involves some of that research, education, funding. We're trying to hit at these issues from multiple perspectives.
Are long-term maintenance and treatment plans expensive for families to maintain? Could that be a reason to not?
It depends on the issue and the type of treatment device. Typically it can be more expensive on the front end. It's more expensive if you decide to do a whole house treatment system rather than a point of use, obviously. So it can be very expensive to not very expensive at all, depending on the issue. When we look at treatment options, we are very careful to make mention that it's important to look at the full chemistry of the water, because different constituents can impact the effectiveness of the treatment. So if you have high iron levels, that can cloud the media, which impacts the ability for the reverse osmosis system to function properly. So, it's a holistic approach to the water.
Is there a distinction between potable water and non-potable water?
Yes. I think the definition potable means safe to drink, safe
Yes,
for
correct.
human
When
consumption.
these assessments are made, how you said it can be a whole house treatment plan versus at the point of use. So they have the choice of making those decisions depending on whether they consume the water.
At the point at which they take ownership of that well and that home, if an issue comes about, that's their decision, the property owner's decision, the well owner's decision, whether or not they want to go with a point of use system or a whole house system. Yes, sir.
Tracy, can I ask a question?
Yes.
Is that a real estate disclosure requirement? If somebody tests the well and it comes back with an issue, and then they're selling, but to his point, they don't mediate the problem?
So that's a great question. That is not required. So if someone in the state of North Carolina purchases a home that has a well water sampling is not required unless it's minimally required by the bank. Like a VA loan will sometimes require bacteriological analysis. Very rarely do we see any requirements for an inorganic panel. That's something we would like to see. It's very important, the water that is supplied to a home, it's very important, but that legislation is not passed. It's not in place. So again, community education and outreach, we've got the arsenic form, arsenic educational information, and a few other things that I'll touch on as we go through. And then we try the best we can, as much as time and staffing allows, to participate in research partnerships and other projects where we can really address these issues from a public health standpoint. So to your point, the responsibilities for ensuring well water is safe, properly maintained, that relies with the well owner. We do educate folks on, proper maintenance timeframes, like sampling for bacteria every year, sampling for inorganic panel and nitrites every 2 to 3 years, and so on. So it's very, very important. A lot of folks just have no idea. They don't have any idea about maintenance with the well. They don't understand about water quality and that it's their responsibility. So we do a good bit of education and outreach to educate folks. And that's a picture of a well here in Union County. That's kind of what it looks like after it's drilled. That's your bladder tank, the well itself, and they do have a cartridge there, just a carbon filter cartridge off to the left side. So our most common contaminants in Union County groundwater are manganese, arsenic, iron, coliform, which is an indicator bacteria. It's non-specific, it just indicates that some type of contamination is present. If a sample is positive for coliform, the lab goes ahead and checks for E. coli, which is an indication of fecal contamination. So of the 30.5% samples that are present for coliform, 6.5% are also present for E. coli. That's a concern. Yes, sir.
Yeah, Tracy, thank you for the information, but I just wanted to ask a question because I know you've given this presentations similar to this before in the past years. My question, when I hear this, I just wonder, is because of the fault lines, and you talk about Union County, does Union County, how do we stand across the state as far as when it talks about well watered? Are we at the latter bottom as far as all these contaminants, or are we average, or how do we stand with North Carolina as far as across the states, across the county, the state of North Carolina rather?
So as far with regard to arsenic and manganese,
All those, yes, contaminants.
well, just taking manganese and arsenic out separately, because that's an indication of our geology in the area. I don't think it's an overstatement to say that we're a hot spot.
A hot spot in?
Hot spot for elevated arsenic and manganese. Iron goes along with that. That's common to the formation. Coliform is concerning, although some of that has to do with the fracturing. If you're drilling a well and you have vertical and horizontal fractures, the fractures are occurring crosswise, that can be an indication of that. So sometimes installing a liner or grouting the full depth of a casing can mitigate some of that. Some of the issues we see are related to well construction, particularly with coliform. So we can require full grout in areas where we have good data to support a stronger construction install. We have to be careful with that because all decisions we make have to be, data driven. But that's true. Union County, each area of the state may have its own particular issues, but because of the geology, not only Union, but Stanley, Richmond, some other counties that are falling along that hot spot of the slate belt, they all have those issues. Now, what's unique to Union County is we have really excellent data. We have an excellent GIS department. We have, the ability to map this information, and it's highly sought after. We've provided it to the state. We've provided it to Chapel Hill for the UNC Superfund Research Project, and I'll talk a little bit about the projects that we're working on also.
So the treatments for arsenic, are those pretty effective, the treatments?
They're very effective, yes.
Thank you.
It's just how you get to it, yes, sir. So here's an updated map of arsenic that you're seeing. This data was updated just last month in May of 2024. So what this is, and I included a larger copy of this map in your packet, but the blue is an arsenic level that is present, but it's below a maximum contaminant level. So it's okay, it's below 10. The red exceeds the EPA MCL, and then the black is it severely exceeds the MCL.
These
So
are
that's
publicly
above
available?
0.3.
Are these maps publicly available?
They are not on our website yet. I mean, you have copies now. I'm happy to share them with you. And then, we're going to click on this, and I'm going to show you the data viewer that we use through the GIS system. So we're constantly refreshing these. Let me just kind of talk about this a little bit. One of the concerns with arsenic is it's odorless, colorless, and tasteless. So you would not necessarily know that you have it, particularly if you've been drinking that water for a long time. It has a particular taste. Well water is a little bit different than bottled water. So it's something to think about, that you don't always know that you have it there, or you wouldn't typically know that you have it there. Occurrence can change from lot to lot within a subdivision. The concentrations can also vary in a well over time based on the geology and how the groundwater behaves. We all know that arsenic is problematic to humans. It's carcinogenic. It can elevate your risk for lung, kidney, liver, and bladder cancer, and also skin cancer. MCL of 10 micrograms per liter, which is the MCL that the EPA has established, gives you a lifetime cancer risk of 1 in 150. So we've got a couple of common treatment options, and I'll talk about this a little bit more, and it's also provided in a little more detail in the arsenic fact sheet that you have. But we typically see adsorption systems used or reverse osmosis systems used. We call them RO. The thing with RO systems is there's two different types of arsenic. One is more acutely toxic. That's your arsenite, that's trivalent arsenic. We convert that arsenite to pentavalent arsenic or arsenate for it to be treated by reverse osmosis, and that's what we typically see for point-of-use treatment systems. And then we have manganese. Actually, let me go back in. You want to so we're going to take a look at the GIS viewer so you can get an idea of. So this is our GIS mapping system. This is the maps where we enter our data into the database, and it's populated here, and I can filter the data using different criteria. So I can look at just the samples that are not elevated. I can look at the samples that are elevated or severely elevated, and add or take away different layers on these maps as needed. Notice the green line there. You can probably see it pretty well. That is the Carolina Slate Belt. So you can really see on this enlarged map the clusters of elevated arsenic levels in wells to the right in the county within the Carolina Slate Belt. Go back to manganese. So manganese is another contaminant that we see very commonly in Union County. Typically, when it's typically seen, it's known as more of a nuisance, and also elevated above secondary maximum contaminant levels and above public health risk levels for manganese. So you have a double whammy there with concerns with both those neurotoxins. And again, at higher levels, we don't see those levels everywhere, but in some locations, and you can see the black diamond is the severely elevated manganese levels, the levels at which the public health risks to humans are there. You can see a good cluster just to the right of Fairview, up at the upper part of the map. And this is an example when you have super high levels of manganese, it can affect your water treatment efficacy. So another project we've been working on over the last year or so, I know you've heard about PFAS, per and polyfluoroalkyl substances. These are substances that are man-made. They are everywhere now. They are ubiquitous in the environment. And they were used many, many years ago, starting in the 30s and 40s in like nonstick cookware. They're also used in food packaging, water and stain-resistant fabrics and materials. You know, I mentioned nonstick products. They were used in firefighting foam. I believe that's been stopped now, but it was used for many, many years in firefighting foam. So used in industrial processes, and it's everywhere. It's everywhere. So our Union County Water, Union County Public Water has started sampling our water supply for PFAS. And this past year, Environmental Health has been doing some baseline well water sampling for PFAS. I want to get ahead of this. This is, something that's of concern. We know that the EPA has announced final drinking water standards for MCLs for PFAS, these 6 PFAS in particular. So at this point, we in Environmental Health has sampled 8 different wells, 2 in each quadrant of the county. We've stayed away from drinking water wells to a certain extent because we don't want to run into issues with reporting that information out. But the good thing is we have not seen high levels of PFAS. We've seen some trace amounts, which is common, but for the most part, not elevated levels. I'm still looking through the last 4 sample results that we received, so I'll reserve my comments on that until I have a chance to kind of really dive in on those. But I just wanted to let you know that that's on our radar and we're concerned about that, particularly when additional regulations would go into place for public drinking water. I don't know if those will also affect private drinking water wells, but it's a human health concern and we're concerned about it from a public health perspective. So we have I'm just going to kind of run through some of our current projects and initiatives. I think I mentioned some of our targeted educational materials. That's contaminants, treatment options. We're always looking for options and resources to provide to property owners for well repairs. I brought a couple of our other pamphlets that we created recently. One's for wells and water testing. We have everything in English and Spanish. Pass that around. As you can tell, I'm really super proud of all of our education and outreach materials. And this is a special one that we made for newborns. So families that take their infant home from the hospital and they have well water, everybody gets one of these from Atrium. Everyone, that takes their baby home, there's a little packet. So we send this home. This is also English and Spanish, and just talks about, educating folks on, what is well water, what to be concerned about. In this case, it could be lead also, but, and then the sampling frequency for folks that want to maintain that water quality. So we do a lot of follow-up consultations on interpreting results for citizens. They have a lot of questions for us, well repair, water treatment options. We do a good bit of just phone communication, meeting folks in the field where they live. I had mentioned this probably last year sometime, but we also rolled out a drinking water well repair and rehabilitation program. Super excited about that. It's stalled a little bit with some of the funding and selection process, but it is a very, very exciting program. What that involves is a two-phase application process. Someone submits an application, they qualify from an income perspective, and once they pass that benchmark, they're forwarded to environmental health, and we do a full well assessment. It includes a full water panel, we do a downhole camera, we do a site assessment, we determine what's going on, we interview the folks, find out what's happening, and up to $30,000 we will fund the repair or treatment that makes that well and that water potable for that family. Very, very much needed in Union County, so I look forward to seeing that move forward into the future. I mentioned some of the research projects that we're working on. Most recently, it was the UNC Superfund research project that involved partners with not only Chapel Hill, but NC State and UNC Charlotte. I can click that. So this is their webpage for the Superfund Research Program. If you'll click on that collaborative research, shows legacy, ancient volcanoes. So this is one of the web pages that talks about, the background of the geology of the area. And if you'll scroll down just a little bit, down there's the slate belt that everybody knows about now. Down just a little bit. And then you'll see there's a link to click on the UNC Superfund Community Engagement Core, work with health officials in Union County. So this is our project. That is the Union County Ag Center. That's the community report back meeting. This is the project that we assisted with. It was called Well Empowered. So it's a citizen science project where property owners were targeted based on their demographic location and information that we provided on known locations of elevated arsenic and also co-contaminants like manganese. Folks were given sample bottles, so citizen science. They collected the samples and brought them to different locations in the county. One was the government center, one was right out front this building, and one was at the Ag Center. And the samples were collected and analyzed by the researchers at Chapel Hill. And then they had a report back meeting. So they weren't just analyzed for arsenic, there were other contaminants they were evaluated for too, which includes like lead and other concerns. So it was a very exciting program. It wrapped up last fall, and it was really well received. If you are interested in looking into more of this project, there's a whole bunch of information on the Superfund Research Project. There's a YouTube video of the community meeting, just a lot of information there. Let's see, if you'll click on, let's see, for communities, see that subtitle, that right over there, for communities, yeah. And scroll down just a little bit. So a lot of really excellent information. That Well Empowered was our project. You'll go down a little bit more. It includes mapping, which you guys were interested in mapping. You can see on that map right there where Union County is, and we are a hot spot right there for arsenic and manganese.
Tracy, I have a question. The Superfund program is primarily about cleaning up hazardous waste sites, isn't it?
Historically, that's where they've been involved.
This has to do with geological deposits.
Naturally occurring, that's right. So this was a special project that they were able to have funded. Now, arsenic can be deposited by industrial processes, poultry farming. We know that historically the birds have secreted arsenic based on their feed that they were given or chemical used in the production. Not anymore, so that's good. But and we haven't really been able to correlate any issues with poultry farming and our drinking water wells in the county. We have not been able to correlate that information as far as a causative factor. We just haven't been able to do that. So that's the map that I believe you were interested in, that shows Union County, Anson County, Stanley County also. So just wanted to share that information with you in case you wanted to do a deeper dive into geology and wells in Union County. But thank you so much for your time this evening. Does anybody have any questions?
Well, I just want, go ahead.
Oh, so when you have those groups where there's a lot of contaminant in one area, is that still up to the individual well owners to take care of that, or is it at some point, is it like a bigger problem?
So yes, each individual well is their responsibility.
Even if all your neighbors have the same issue, it's just, okay.
And that's based on how the regulations are,
Okay.
are oriented. There is some grant funding that's available for other contaminants, but arsenic does not qualify since it's a naturally occurring contaminant. Oh, and can we go back to the second? Yeah, that just real quick. Yeah, that one. Actually, I'm sorry. It was the next to the last slide. So, I'm sorry, I wanted to kind of finish my list here. Sorry, I got carried away. I'm sorry, I should. Okay, so the other things I wanted to mention just real briefly is, we have a new epidemiologist on staff at Public Health. So she's been working with me to take a look at our water sample database and correlate that with some of the human health conditions in the county to see if there's any correlation with those. We're also looking at working with Union County Building Code Enforcement to make sure that a certificate of occupancy is not issued unless well water is potable. That's a very important issue. And then we also, for several years now, have approached Union County Public Water. We want to make sure that they are aware of hotspots with water issues and even clusters of malfunctioning septic systems. So when they do strategic planning, that they take that into consideration when they're extending water lines and sewer lines to pick up some of these areas that are having these public health issues of concern. So sorry about that. I missed those last couple of things. Did you have a question?
No, I was just going to say thank you again, Tracy, for such thorough presentation. What's more important for us to consume than water? So thank you, Tracy.
Yes, sir. Thank you.
Is that all the reports, I guess? So now we're going to do the division reports, or whatever you want.
Quick update from business operations. Janet was talking about the budget earlier, and we do have an organizational change in my shop. One of the areas that I'm responsible for is business processes and training, which is our CQI team, which is headed by Cheryl Bowers. And they work in tandem with our training team, which is headed by Daniel Pena. And as part of the budget process and the county manager's overall vision for moving forward in FY25, they have looked across the organization, and I'm pretty pleased to say they have actually selected 3 of my trainers to participate in a strategic initiative through the county manager's office, through Megan Parks, the new strategy and innovations director. So I'm super proud of the work that they've done in human services, and I think it's being reflected in the fact that they were selected to be on this team. So we will still be doing training in human services and for human services at the program level, and any other ways that we're able to support the initiatives being done by the CQI team, which is our business processes. So we look at SOPs, policies, and things of that nature, do value stream mapping and things like that, and then where the areas and the gaps are identified, the training team has picked up some of those processes and helped to train on those. So we'll continue to figure out what that looks like and how we'll reevaluate that portion of human services in terms of the training needs that will continue once those trainers transition. But I'm super proud again of that team, the leadership that's happened in that space, and the acknowledgement and recognition to select those team members to go over to the county manager's office. So.
Hey, I'm Karen Tucker, Division Manager for Economic Services. I'm standing in for Ashley tonight while she's on vacation, and she asked me to give you a few updates. As far as our vacancies go, we have 8 vacancies within my shop and economic services, but 2 of those are getting ready to have offers sent out this week. So we'll be down to 6 vacancies. And then on the social work side, they have 4 vacancies, 3 in foster care and 1 in investigations. I wanted to also give you guys an update on the call center and the move from contracting our child care eligibility services out. Our contract began last month. Their team started last week training, and so far it's going well. Obviously, with just 1 week under us, I'm not sure how it's going to end up, but they are doing well after 1 week. The team that they have hired, they're all very, very eager to learn. We are interviewing for a supervisor of that team this week. I have 2 interviews scheduled, and then we'll make that decision this week and have someone start. We have a call center development team that is comprised of our staff, some of our staff from food and nutrition services, some from our Medicaid teams, and then some from our child care team. And we have met for 2 full-day meetings where we have worked on developing our operating procedures, our workflows, how we want the call center to function. And we have 1 more full-day meeting to finalize all of our standard operating procedures, and then we're going to be testing our workflow with the call center within just that team, within the development team. Once that takes place, we're going to make any changes to the SOPs and the workflow that we need to. And then our current child care staff will start training on food nutrition services and Medicaid towards the end of next month. Once they get trained, we will do a full week of testing with them for the call center, and then hopefully open the call center mid to late August. It's my goal to make sure that we have every obstacle addressed before we get there, so that when we start letting everyone know that we have a call center, that there are as few hiccups as possible. So I'm really, really excited about that. The staff are very, very excited, especially in food and nutrition services and our family and children's Medicaid teams, because our phone calls are overwhelming. We do plan to do some community outreach with Nicole, getting her to help us get the word out that we have a call center, so that hopefully we will reduce the number of clients coming into the building that are just here to ask questions. We really want them to utilize the call center. 1, it saves them time and it saves them money on gas, and it helps us continue to just be able to process cases all day long instead of our caseworkers getting interrupted. So our timeliness increases and our workers are happier. Any questions?
I sure do love a win-win-win. That was-
Me too.
I don't have any other updates. I think Stephanie may.
Since you're talking, gosh, is this working? Yeah, okay, sorry. Can't hear it working. I guess that's good. Since you're talking about vacancies, we have 2 vacancies, actually 2 that we thought were filled, but now we have 2 vacancies. Actually, we have 3, but 2 really vital ones. One is our part-time site manager for our senior nutrition program. So we have 2 part-time site managers who kind of rotate to the sites, run routes, and do all sorts of things, and including some administrative work, which is really important. We have to evaluate every single client who receives homebound meals twice a year. One has to be in person, one has to be on the phone. And so they help out with the ones on the phone, often the lower level ones that aren't as high need. So it's really important that we keep those filled. So one of those is open. And then we thought we had filled our senior volunteer coordinator position. And again, just so you, just to remind you, that position is over our Christmas Bureau program, our volunteer income tax program, helps coordinate the volunteer lunches, and does school supply drives, and we do Easter baskets and a whole bunch of other projects. So it's real important to have that filled. Unfortunately, the person we saw, or fortunately for that person, she had accepted the position, but rescinded her acceptance because she had another opportunity that was better for her, and we're really excited. However, we have a vacancy now. So if you know anyone, please let us know. That is a full-time position.
Just a quick update on transportation. About 2 years ago, we came to the Human Services Board and presented information on biofuel and converting our vehicles to propane. And I'm happy to say that in April, we converted our first vehicle. We now have 6 vehicles converted. 3 more are on the way, and when we get them in, we're converting our replacement vehicles. So the new ones that are coming in, those are the ones that we're concentrating on. And in the short month and a half that we have started on propane, there is definitely going to be a savings that we see. It is almost half of what we were spending on gas. And our vehicles are only going to the gas station maybe twice a month right now to get gas, and that's when they're on half a tank. So it's not a lot of money spent on gas right now either. And we will be soon working on a bid to go out to put a propane pump at the Progress Building so our vehicles can fuel up there instead of having to go out in the county. We are partnering with Union County Public Schools right now to use their propane pump. Thank you.
I just have one thing. I don't know if you know this or not, but June is Mosquito Prevention Month. So please, if you would like to have 4 mosquito dunks for your property, or if your neighbors want some, have them come by Environmental Health. They'll get 4 free mosquito dunks with some educational information, and we want to cut back on the mosquito population before they get too bad this summer.
Is that all the division reports? Well, I never like to close out a meeting or adjourn a meeting without having our commissioner give us an update on the county on things that might be able to help us out with a little bit better understanding of where the county's going.
Thank you. Thank you, Mr. Chairman. I really don't have much to add. I thought Janet did a superb job of giving a summary of the county manager's budget. I think reading between the lines, you can see that a lot of hard decisions were made by the senior county leadership. Some of them I agree with, some of them I don't. And you'll see how I vote on it at the next meeting. I really don't have anything else to add other than that. I will say this because this is close to my heart, and Tracy did a great presentation on it. I mean, water quality issues have concerned me for a while. I mean, being in this slate belt, it's just, I mean, it's a problem. And how do we solve it? I mean, you know, a quarter of our residents are on wells, and a lot of those wells have unacceptably high levels of arsenic and manganese and some organic compounds. And, you know, it's difficult and expensive to fix. We got a presentation, I remember last year, from our consultants who are working with Public Works that indicated to run county water countywide would cost over $1 billion in this interest rate environment. So that's just the bond issuance. So and we're a tier 3 county, so you know we can't expect to get much help from the feds or from the state in terms of extending water throughout the county. Fortunately, we do have, as Tracy talked about, this, well repair and rehabilitation program, and we have block grants and ARPA dollars that, we can contribute there. And I think that's, that's so important, and it's a lot less expensive than extending, county water everywhere. But it's a problem, and I'm glad that at least, near the end of my term, we've got some funds to try to do some things, what I would call the low-hanging fruit, grabbing some of the low-hanging fruit and addressing some of this. And I'm glad to see that, the folks at UNC, and others throughout the state and probably even the country, are doing more research, and that we're getting such good data, because getting great data is, what you have to start with, before you solve the problem. So, is it satisfactory? Is it the end result that we'd like to see? No, but, to my mind, don't let the perfect be the enemy of the good. And it's some progress. And I guess I'll have to take that. So thank you. Thank you for indulging me.
Well, thank you, Commissioner Williams, and thank everybody for coming for a very informative meeting. And with that, I would ask for, does anyone have a motion to adjourn?
So moved, Mr. Chairman.
Okay, Commissioner has made a motion. Anyone a second? Okay, Brandy is seconds the motion. All in favor say aye.
Aye.
Any noes or